Hello, my name's Mike Jacobson, and it's my honor to be the founding dean of the UNT System College of Pharmacy. For the next few minutes, I will be your travel guide to the UNT Health Science Center's latest efforts to make healthcare better through teamwork. Thank you for joining us. The UNT Health Science Center continues to be ground zero for new models of teamwork that make healthcare better for all of us. The latest in that effort is the new UNT System College of Pharmacy, scheduled to open in fall 2013. The four-year program will lead to the Doctor of Pharmacy degree. The pharmacy school joins the Texas College of Osteopathic Medicine, Graduate School of Biomedical Sciences, School of Public Health, and School of Health Professions on our growing Fort Worth campus. Teamwork is the theme of this new school, and it was evident at its very inception.
When I came to the UNT system 10 years ago, people were already talking about the fact that Dallas-Fort Worth did not have a full four-year pharmacy program, that our hospitals and pharmaceutical companies wanted it, that we had opportunities for growth and research, and that we ought to seek it. So fortunately, we ended up having interest not just from one legislator, but from our region's delegation, in which Senator Nelson and Senator West, Representative Crownover, Representative Guerin, Representative Giddings said it's time for Dallas-Fort Worth to have a pharmacy program. The UNT system has sought approval at each of its three campuses, and so we're going to approve a system-wide College of Pharmacy to be headquartered in, launched at the UNT Health Science Center in Fort Worth, and it's gone from there.
While physically, the school is just shell space at the moment, it will be unique not only because it is the only school of its type in the entire North Texas region, but it will be the only pharmacy school in Texas located on a Health Science Center campus. The benefit is that future pharmacists will be educated alongside other healthcare professionals from the start. This will give them valuable early exposure to the teamwork crucial to making healthcare better.
And as we develop our curriculum in pharmacy, that's what we're doing, and building in interprofessional training where students in these various disciplines can actually sit down together, look at a problem, and help solve it.
The school will also allow the creation of new research knowledge that will contribute to the development of new therapies.
Adding pharmacy to the Health Science Center really adds another dimension to our whole research efforts. With faculty expertise that we didn't have prior on the campus, we will now have working with us to help with drug discovery and drug development and therapeutics.
I'm quite sure my research colleagues in the School of Pharmacy are going to be able to generate new knowledge in pathophysiology as well as pathogenesis in various disease areas. We will identify new potential therapeutic targets, and we will evaluate and develop new therapeutic agents as well as treatment paradigms.
For pre-pharmacy students on our flagship campus in Denton and across the North Texas region, our school provides an attractive next step that hasn't existed previously.
We've needed a school in this area for many years, and I think that will open up opportunities for a lot of people who may even be out of school. I have phone calls often from people who say, I have a family here, I need to stay here, but I want to go to pharmacy school, I want to be a pharmacist and serve the public in that way. Being able to work with the faculty who they've started hiring, those are people who are leaders across the United States. The students are going to be so lucky to have them because they work in the field.
Healthcare today is truly a team sport, and the future pharmacists trained at the UNT System College of Pharmacy will be an increasingly important player in the health and well-being of patients regardless of the settings in which they work. In the inpatient or hospital setting, for example at Plaza Medical Center, pharmacists work closely with physicians, physician assistants, nurse practitioners, and other healthcare professionals on the patient care units to help tailor increasingly complex therapy.
Well, private pharmacists are really very actively involved with the patient care at the bedside. Our pharmacists around on several units, especially critical care units. We are playing a clinician role in the medical team, and I see there will be more and more need of the pharmacists to be a frontline and taking the patient care right when they need it.
At Walgreens, pharmacists assist in the transition from hospital to home, as well as have an increased role in outpatient chronic disease and everyday medication management.
I've had the opportunity to work in the normal retail setting, but also in some of our specialty settings as a pharmacist, including our on-sites, which are located inside of hospitals, where we provide direct care to patients who are being released from hospitals. And having had an environment where pharmacists are counseling the patients and giving them their discharge medications, they no longer feel alone. So what we've done is we've brought our pharmacists from behind the counter and taken away or limited some of those perfunctory roles to put them out front. We're seeing people understand their healthcare better. They're getting more immunizations, more healthcare testing, and improved medication therapy management.
In independent pharmacies, such as the Perrone Pharmacy in Fort Worth, the pharmacist has an ever-increasing role in patient care compliance and quality.
First of all, is we've been hiring more pharmacists with clinical and hospital experience who can more effectively communicate with the patient's caregivers and as well, of course, the other healthcare providers. What we're doing is assisting the patient in medication compliance by offering compliance packaging, which helps them keep track of their medication more readily. And this way the physician can monitor it, the patient can monitor it, and it's huge because 28% of all hospitalizations among the elderly are due to medication mismanagement. That's the #1 reason why patients end up going into nursing homes or assisted living facilities as opposed to being able to go home and live independently. So we feel that we're meeting those challenges.
More globally, the pharmacist has a critical role in public health, population management, and disease prevention.
We're talking about an obesity epidemic, we're talking about diabetes management, issues like blood pressure management and so on. These are chronic diseases that can be managed if you have a proper management system in place. The pharmacist and the pharmacy is a good point of intervention for many of these activities that have to do with chronic disease management.
There may be no better example of population management practiced on a daily basis than the collaborative care a geriatrician and pharmacist provide to seniors. Chief of Geriatrics, Dr. Janice Knebel, is excited by the prospects of the new school and the opportunities it will add to our healthy aging area of strength.
The role of the pharmacist as a very active and vital member of the healthcare team is going to be increasingly important with the aging of the population. I think that as we age and the number of medications that we need to use, we need to safely use them. But the opportunity to start in year 1 of pharmacy school, medical school, PA school, PT school, to have those students interact together, I think will really help us create the healthcare delivery system of the future.
Looking forward, the exciting idea of personalized medicine is starting to take shape. At the Health Science Center, our world-class program expertise in DNA, combined with the expertise of a pharmacy school, has the potential to make us a leader in personalized medicine.
Well, I think that having a school of pharmacy, first of all, makes us unique in that we have an institution that doesn't exist anywhere else in Texas that allows us to facilitate working on drugs and how people respond, and allowing us then to tap into that to allow us to determine the genetic mechanisms that will help us better determine who may be at risk, as well as who may respond better to drugs. You could save lives, yes.
And what other potential does the new college provide? It will help bring Fort Worth's dream of becoming a destination medical city with a vibrant life science economy closer to reality. I hope this brief glimpse has given you an understanding of the new UNT System College of Pharmacy and the potential it holds to create solutions for a healthier community. I look forward to updating you more in the future and leave you with a few parting thoughts from our faculty and partners.
The chance to help build a new school at the ground level is always exciting. I'm quite sure that we'll be an integral part of the healthcare as well as the well-being of this wonderful community.
It's a great opportunity for our students, and I think the whole community will benefit, and it's just an exciting time.
We're thrilled about having the resources of a fabulous faculty and great pharmacy students right in our own backyard. I think it's going to be a fabulous collaboration.
I love it when I have pharmacists who come back and say, hey, I want to work in the neighborhood where I grew up. It's all about having people knowing it, because nobody's a Texan like we are. Texas is so diverse with so many different people. I think we've missed a lot of folks who couldn't leave. Now we're going to be able to bring it all back and put that little bit of Texas spin on it, because what they say, you don't mess with Texas, because everything's bigger and better here.